Hello guys, welcome back to the channel. It's Unit 7 Part C. APH. This is one of the main disorder that is seen in pregnancy, that is antepartum hemorrhage. Anti in the sense before partum pregnancy, hemorrhage in the sense bleeding and blood clots, both considered to be in this. A bleeding occurs from the vaginal area, that is from genital area, bleeding occurs, that too before 28 weeks of the pregnancy. In the middle of the pregnancy, if there is a bleeding is occurring, if a bleeding is observed, that is considered APH. In that we have various types, and these two are the main type in that is placenta abrasion, placenta previa. Because of these two conditions, bleeding generally occurs, and that is known as APH. First, what is placenta abrasion? When a baby is formed, so baby starts to grow like this. This is the uterus, and in this uterus we have a placenta here, an umbilical cord, and a baby here. Like that baby grows. Okay, this is placenta. When the baby is growing in, this placenta will get disattached, will get separate and fall off. That is placenta abrasion. If it's getting disattached, then automatically there will be a tear of tissue. Then there is bleeding occurred. This is placenta abrasion. Now placenta previa. Placenta previa in the sense, this is uterus. Okay, this is uterus. In this uterus, placenta should be up here, but in some cases this is opening, vaginal opening. Okay, in some cases this placenta will be in this opening area. I will provide an image like that. If you see, the placenta is present, it is blocking the way of the birth canal. This is placenta previa. Placenta abrasion is nothing but separation, okay, of the placenta. So what are the reasons why it might occur in the pregnant women? Because of some kind of medicine uses, drugs overuses, or if the mother is alcoholic, if she is smoking, in that conditions also, or if she is having any underlying diseases like this conditions, underlying conditions like hypertension and sugar, if she is using drugs, if she has any trauma in the sense, if she underwent any kind of accident or any kind of problem in her, then automatically placenta abrasion, the disattachment of placenta occurs. And the main thing is this one, multi-paternity, means two babies or three babies within the within the uterus. If you see, if there is two baby, then placenta can't withhold the weight of two babies. So if it is can't withholding the weight, then automatically it fall off. Because of multi-paternity, placenta abruptio occurs. And the main symptoms that can be seen here is painful vaginal bleeding. As soon as the placenta is getting disattached, there will be heavy pain and heavy bleeding will be caused. Then automatically patient comes to hospital. There will be contraction in the uterus will be seen. Apart from this, there is a chance that patient might go unconscious. The heart rate will be increased. Vital signs will get fluctuated. This all seen in the patient. And what is the diagnosis that is done here is, do note few more points. In the diagnosis, every time we do take patient's history, previous history, everything, general checkups, vital signs. You have to write it on your own. Apart from this, anything specially will be mentioned here. Okay. The main thing what we do is ultrasound. Clinical suspicion is nothing but your own, that the physical examination will be performed. Ultrasound will be performed here to see what the condition inside it is. In this condition, the birth canal will be blocked by the placenta inside the uterus. That's the condition. The cause for this is previous C-section. In the previous delivery, if the patient was undergone the C-section, then automatically this time there is a multiple chance for placenta previa. Apart from this, multiple gestation, that is more than 2-3 third pregnancies like that. The main risk factor in the placenta previa is the advanced maternal age, that is, the mother age is more than 35 or around 35. In this condition, placenta previa is commonly seen. Symptoms for this is painless, since there is no tear, so no need to worry, there is no pain, but the bleeding will be excessive and it is in bright red color. The diagnosis, that is what is the examination that is performed, is transvaginal ultrasound. In this placenta previa has various types in it, that is partially blocking, fully blocking, like that. To see at which way the placenta is blocking, we do transvaginal ultrasound. Types of placenta previa, we have marginal, partial and total. If you see in marginal way, the placenta will be situated in the margin, it's not even blocking the way, but still it's a placenta previa because on further going on it will block the way. And partial is, if you see here, the hole is partially blocked, that's why it's partial placenta previa. And here the placenta has totally blocked the way, this is total. If you see, this is the 3 degree that is seen in placenta previa. In placenta abruptia, we have just 3 types, which is mild, moderate and severe. Mild is the placenta will be little bit separated from the uterus. In moderate, little more. In severe, almost whole placenta has been separated from the uterus. Mild, moderate and severe are the 3 degrees that is seen in placenta abruptia. And in placenta previa, we have 3 degrees, that is marginal, partial and total. The management for placenta abrasion and placenta previa both are almost the same, that is leading to C-section delivery. We will wait, we will support the fetus growth, and after few weeks we will perform C-section delivery. For the management section, you can add up what are the C-sections care provided. That comes under this management. Apart from this, we can give up common managements. Those are, for bleeding we provide blood transfusion, vitamin tablets, iron tablets. Next we provide painkillers like sedative ones and fluids. Pregnancy with anemia. In the pregnancy period, the woman sends the blood to the baby. Since she is sending the blood amount in her body which is produced should be more than the normal. But in some women, the blood is not enough and that leads to anemic condition. This can be in any form. Come, let's see its classification. It can be normal physiological or pathological form of anemic condition, or else because of any deficiency also this anemic can occur. Like if she has any iron deficiency, then it is iron deficiency anemic. Follicle deficiency, vitamin B12 deficiency, protein deficiency. Because of any deficiencies, anemic can occur. Apart from this, if there is any bleeding based on that condition, if there is little bleeding, then that can be acute anemic condition. If she had any accident or any kind of injury and there is lot of blood has been lost from her, then it can be a chronic anemic condition. Apart from it, if she has any underlying disease and because of that her body is losing blood, that also comes here. The management of anemic condition starts with oral route, and tablet will be prescribed, ferrous tablet will be prescribed. If the patient has any problem of consuming the tablet, like she has a problem in observation, her cells are weak in observing, malobservation is seen, or if the anemic is very severe that oral therapy cannot go with it, then we will go with injections, that is IM route and IV route. In the injection, if you see, we had two options, Imferon, Jactofer. This two, before providing, we will give a test dose of 1 ml. If there is any kind of reactions, we will stop it immediately and we will go with alternate sources. If not, then we will go with it. Apart from it, if the condition is very very severe, then we will go with blood transfusion also. These are the management of anemic condition, but the main thing is in the nursing care. We will advise the patient to follow a good diet, And this advice is provided from the beginning of the pregnancy itself. A good diet with lots of green leaves, iron, follicle foods, everything should be consumed. Good exercise also helps to maintain the good blood rate, and drinking plenty amount of water helps to clean, purify the blood. Eating good fruits and vegetables and avoiding junk foods, avoiding beverages. If she is exposed to the smoking environment, even that may affect the production of blood in her body. So saying her to stay in a safe environment, like that. Here the main thing is you have to provide a good nursing care. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.